Hi, I'm Angela Trimbur. I had cancer. I'm here with good support to sit down with women like myself to discuss our breast cancer journeys. I'm sitting here today with Angela and Aleah. Thank you so
Hi.
much for coming.
Hi, thank you for having me.
Let's dive into it.
Let's go.
Okay. Diagnosis. Where were you? How did you feel? How did you find out? Tell me whatever you want, but tell me everything.
So I was obviously shell-shocked and blindsided by my diagnosis, as most cancer survivors can relate to. I was 31. I had no history of breast cancer in my family. I was putting on a sports bra and you adjust, and I felt something and I thought, I don't want to mess with this, so I immediately called my doctor.
What did it feel like?
It felt like a squishy grape. That's what I felt like in my mind. That's what I imagined it. My doctor was like, I feel something there, but you're so young. I'm not, and you don't have a history of breast cancer. So she said, come back in a month. We'll see if it's grown, changed, anything like that. So I came back the next month and she said, I was like, is it smaller? Did it shrink? She said, no, it's still there. So they sent me in for a mammogram, and I did that, and ultrasound right after that. And I thought, okay, everything seems fine. They weren't saying anything, and they said, we're gonna need to do a biopsy. And then I thought, oh, okay, this seems a little more serious. Before that, I really was kind of like, it's a cyst, I'm young, there's no way.
Were you expecting to get the call? You were waiting, like, we're gonna call you Monday, so
Yeah,
all
and
day
I was actually in the car, saw the doctor's name pop up on my little call thing, and I was with my now fiance, and I said, oh good, the doctor's calling, let me take this so that I don't have to worry about it, because I thought they were gonna tell me, like, everything's fine. And they said, we're so sorry, but it's cancer. And I was so shocked. I did not know what to do. I think up until that moment, I didn't really believe it was going to be cancer. And when they finally said it, it was like, whoa.
Did you do a U-turn?
I looked at my boyfriend and I said, what do we do? Where do we go? What do we do? Do we keep going where we're going? And he said, let's just keep driving. We're going to your friend's house.
Going to your best friend.
My best friend's house. She opened the door. I knocked on the door because nobody knew that this had happened in the car.
Were you crying yet?
Oh, I was bawling.
Okay.
I was freaking out.
Yeah.
She opened the door and I just like collapsed into her arms, literally like in a puddle of tears.
Yeah, absolutely. And then how fast did things happen from there?
Everything happens fast and slow when you first get diagnosed. I'm sure you guys know what that's like. It's like, it's not, you don't get all your information right away. You get it piecemealed. So I went into the surgeon first and he said, based on the location of your tumor and the size. It was kind of like on the top of my breast, right underneath the nipple. So he said, you're not really a candidate for a lumpectomy just because of the size. It was 8 centimeters. It was quite a big tumor. He said, definitely mastectomy. I don't really think you're a candidate for a lumpectomy, which was fine with me. At that point, I was just like, take it off, take it off, take it off. I decided on a single just because I hadn't had children yet. I still haven't had children. And I thought, well, maybe if there's a chance I can breastfeed, I'll keep one. And they were like, that's okay. That's your decision. So I decided to do the single mastectomy.
I was advised to do a double because I have the BRCA2 gene. When they said aesthetically it would be matching, so it's like if you have one, might as well let it be the other.
And eventually it'll go to the other side.
Right, yeah, eventually.
Again, based off percent, because I carry the BRCA1.
Yeah, BRCA1.
So, yeah,
okay,
BRCA1.
okay.
And I don't have any genetic mutations, so we're running the gamut here. But
Right. You want to talk about your diagnosis?
Yeah. Okay, well, I'm a 2-time survivor.
Oh, wow.
So when she was talking about her story, I was 21 my first time around.
What?
It was to the right side of my nipple on my left side, my left breast. I was laying in bed and I'm thinking, this is pretty hard. You know what I mean? Like, it went from February to the size of a marble. And by the time May came around, it was the size of a golf ball.
Or you went to go
Before I
tell
went to a
someone.
doctor.
So you're just watching it grow.
Went to my doctor when it was the size of a marble. She goes, oh, you're 21, could be a caffeine cyst. Let's not think about it. And I was like, oh, okay, no big deal. She goes, just watch it. Okay, from February to March, all the way to May, already formed to the size of the golf ball. It wasn't squishy that she's talking about. It was like an egg.
Was it painful?
It was like a bruise, like a feeling of a bruise sensation. Like if you touched it, it felt like a bruise. My sister goes, what are you doing? I was like, feel this. Like, what is that? And then she freaked out. My mom's a 2-time survivor as well. Okay, so right away, why did you wait so long? Why aren't you at the doctor?
Yeah.
Go straight to them and they're like, whoa, like we need to send you back to like the hospital. Like we can't do nothing for you here. Just go straight to the emergency room. We skipped the whole ultrasound, the mammogram. We skipped all that. My doctor just went straight in. He wasn't even a breast surgeon. He was just a surgeon on duty, and went and cut it out.
That day?
That day, went in, and I was like, okay, I'm freaking out. I don't know what to do.
So
you panic.
you were in an emergency room situation.
Yeah, just get in. They did the biopsy, and then they're like, you are lucky you found that tumor. And I was like, a tumor? What do you mean? And they're like, that's cancer. And I was like, no.
So you went into surgery and didn't even know.
No, they just removed it, biopsy. They went straight for a biopsy to get it out.
So was that technically a lumpectomy, what you had?
Well, they said just get rid of it. And I was like, I am 21.
It was just called just get rid of it surgery?
I was like, yeah, just cut it off, because your mom has it. Back then, there was no real genetic testing.
Right, this is 20 years ago.
This is 20 years ago. So they're like, your mom had it, so that means it's genetic. And I was like, but I'm 21. Like, I love my breasts. What else are my options? And he goes, well, we can opt out for lumpectomy. Done. I don't know what that means, but let's just do it. They were like, okay, do you want reconstruction? But for having a lumpectomy at the time, they were still pretty even, pretty good. I was like, okay, just a little scar, nothing. Well, as you got older, and your weight fluctuates in and out, and based off radiation, they don't tell you the aftermath of what it's going to look like 10 years down the line,
Very tight
15. It started to shrivel like a raisin, like my breast. And then if I gained weight, this would gain weight. If I lost weight, this would lose the fat. You know what I mean? Before you know it, I was with the A cup with a double D breast. And I was kind of like, I made my own little, I didn't know there was prosthetics at the time because they didn't have any, but I made my own. February was my annual checkup, my monthly my yearly checkup with my gynecologist. He's the one that did the basic, they do the touch and feel, and he was like, there's something right there.
On the radiated breast?
On the radiated breast. Come May, when I finally got it, the biopsy, everything done, it was already the size of a golf ball.
Oh.
And I was like, this is a joke. Like, it went from one side of the nipple to the other side. Again, I didn't have the options of, I just knew I just needed a double mastectomy. And because I had radiated side right here, they had to cut all the skin off on this side.
Yeah.
They had to match it. And I was a candidate to have trim flap, where they removed my stomach, fat, skin, tissue, muscle, everything, and connect it up here. Then you're on a waiting period to see if it even successfully, stays intact.
Yeah.
Hence, they're still here.
Right.
Yay.
Getting a mammogram can be intimidating. There's a lot of false positives out there which could add unnecessary stress. So they've invented something called the Genius 3D exam, clinically proven to reduce the likelihood of a false positive and can help detect invasive breast cancer sooner. So you don't have to worry. Go to genius3dnearme.com and you can find one in your area. When did you have your reconstruction surgery?
So I didn't have reconstruction. So my story is that the surgeon had said, you're a candidate for mastectomy. You can decide if you want to do the double or single. In my mind, I kind of thought the single because of the breastfeeding issue in the future. I didn't know if that was going to be something that was going to work for me, but I thought, let me give myself every chance that I can. You don't want to have anything taken away from you.
Give me your ovaries. That's how it felt. Just give them to me, and I'm like, I'm not ready to depart from them. Like,
and your breast has to go goodbye, and it's so fast. Your entire womanhood is stripped from you so quickly. And so I had my mastectomy, my single mastectomy. They placed an expander, which you have to expand your skin before you get an implant. They placed the expander. Turned out that my tumor was large, and they got what they called barely clear margins. So they like to have a certain amount of non-cancerous tissue when they take out your tumor. So I had radiation after that, and during that time, my surgeon, my plastic surgeon, who was the only surgeon in my practice who would do an implant on radiated skin, he left the practice. So after radiation, I was like, okay, time for my implant. And I had to go see another surgeon in the practice, and they said he was the only surgeon that would do that. We don't like to do implants on radiated skin because of the risk of rejection, the risk of, your skin is just not the same after you have radiation, and it can be hard with implants. They said, if you want to do reconstruction here with this practice, we would prefer if you did like a flap surgery, which is where they take donor site from either your stomach, your back. There's a several.
And that's a
you can do.
huge, like it's a lot. That's a major
it's two surgeries
surgery.
to recover from.
Yeah.
So you're either, because you're recovering from the donor site, which is either your stomach or your back, and you're recovering from the breast.
Sorry to interrupt, but it is not a tummy tuck. It's like a tummy tuck. I mean, you get the perks of it, but again, you are healing from two different areas. And I think they don't talk too much about the aftermath of that surgery.
And because at that point, I had gone through chemo already and radiation, and I met other young women who have done some of these surgeries. And the advice I had gotten from those women was that had done the flap surgeries, you have to really want it, because it's a huge recovery. You're out for weeks, if not months. If you have any complications, it's even longer. And I was like, it's just a no. I knew in my head instantly I was done with surgery.
I loved my breasts before, they were like my thing. I was very proud in a way sexually to reveal them, and I thought they were a little imperfect, and I had the little ski slope. I never had to wear a bra.
Sounds fantastic.
They were just like a handful, as they say in the biz. They don't say that, but hearing that I would get them removed was devastating, and I said, well, I just want them to. Can I get an implant that looks just like them, same size? And they're like, you're gonna have to go bigger, because they don't make implants for women that went through mastectomies. They make them for women that want a yes and, in addition to their breast tissue.
The projection.
I'm about to, on Monday, have my 8th reconstructive surgery. So I'm different in that sense, where I was like, let's get this going. I don't care. So I had this pair. To me, they were like rockets. I felt like a sex doll. Like all of a sudden,
where everybody's just looking at you like this, at your chest.
Well, yeah, it was just like they were orbs, and they were shiny because the skin was stretched. And my friends, everyone means well, but the whole free boob job thing has been thrown at me, where they're like, "Oh, you got a free boob job." It's like that's not. I don't.
Do you do nipple sparing?
I did do nipple sparing.
Okay.
Yeah, which I think is also why they're like, they look great. That's what I would want. They look better than the original. I'm just like, okay, that's crossing a line now. But I felt like I couldn't close my shirts were like this all of a sudden, and they felt so tight, and I had tons of cording, and I could barely, as a dancer,
still have that.
Range of motion.
Yeah.
They don't tell you that a lot of times. Like, your
they
range
don't
of
tell you.
motion may be limited, and you're like, really? I mean.
Yeah. Well, actually, I went to a physical therapist who said, "Oh, we have to work on breaking that cording," and so they actually pluck it like it's like a, I don't know,
like a cello
banjo
or something,
or
yeah.
not
Rubber
cello.
band.
That's it. Yeah, they like break it up and they just rip it, which is
painful,
very
right?
painful, insane. But it worked, and now I have my range of motion.
They pressure and then they pull. And
Yeah.
I'm still in physical therapy. I'm almost 7 months out of post-op. And I just had the one surgery, and just doing the physical therapy, the lymphatic drainage massages, the compression bands. I mean, there is a lot, but like you, I'm like, let me get back to where I was at. You know what I mean?
Yeah. Right.
Being without, I guess, implants or the flap, I mean, that is a choice. I think that's the one choice you get.
So you have a prosthetic
I have a
that you
prosthetic,
wear.
yes.
And what is that like? What does it look like? You would just put it in your bra every morning?
It looks like a chicken cutlet.
That's it. Yeah. Okay.
It's squishy.
You have to have a specific bra to put it in.
Yeah.
Sometimes they have them to where they stick to your actual skin.
Yeah. Yeah, there's a lot of choices. I actually went
had
to a
one.
fitter and got fitted for my prosthetic, so they gave me different, and I have a natural breast to match. So I have one natural breast and one prosthetic. So that's another whole deal, because they're trying to match what you already have.
Right.
So I tried on a million fake boobs, which was
One
an
for
interesting
swimming,
thought.
one to
Oh yeah,
wear
I always
comfortably.
call it, I got my regular boob and my swimming
Mine
boob.
fell out because I didn't have the proper bathing suit, but I had the boob. Went to Mexico and it just flew out.
Oh.
And it went straight to the bottom, and I could not find it. And I was like,
I experienced a lot of options. It's like, do you want over the muscle or under? And apparently under the muscle is a little outdated, and now it's over the muscle. Like my surgeon that I first worked with only does over the muscle. And because there's animation when you go underneath the muscle, when you clench, the boobs move after you clench. And as a dancer, I was like, I don't want animated breasts. I went for a textured, because that was closest to the teardrop shape that I had, but it felt like things are stapled It felt like Tupperware is stapled to my chest, and it was very uncomfortable.
I always felt like a piece of meat was stuck to my chest.
Yeah,
You know what I mean?
yeah.
Like they just bought 2 tri-tips and just stuck them on my chest, and I'm like, I don't feel any like. And again, you no more sensation. Like I'm numb from here down, and I'm like, well, when does that come back? He goes, it may or may not come back. So not only are you mentally looking in the mirror wondering what this is going to look like at the end result, but you're also feeling like this whole body doesn't feel like me.
Yeah.
So in what world is this a free boob job?
Right.
Right.
It's definitely not.
And a,
not
and
the
a
thing
nice
to
tummy
say.
tuck, but no.
Right.
Yeah,
Not
the
free,
same.
free lipo, free breast job. No, I don't want to hear that. When I first had the option, I said, I'd like to just go flat because I've always thought, you know, the ballet body kind of thing. Like, I just don't want them in the way. And my doctor said, well, if you're going to do that, just in case you change your mind, I'm going to leave skin. You're going to look like a little Sherpa, and I'm not going to make you go flat. I'm not doing that. In retrospect, I kind of wish that I just did that.
Okay.
Well, you know, there is a thing now, aesthetic flat closure. Are you familiar?
No.
Where, and it's, I don't know if this is a newer thing or what, but you do have the option.
There is option
to not reconstruct.
Yeah.
And if that's what you want, and your surgeon says, well, what if you change your mind? I better leave a little skin there. If you're sure you don't want to reconstruct, you can insist on it, but unfortunately you have to insist.
Right.
And until surgeons kind of catch up with the fact that
You might actually know what you want.
some of us know we don't want to reconstruct.
I switched plastic surgeons, and this new surgeon, I said, you know what, I just want to go flat. I don't think implants are for me. And he said, why don't we try to build a breast out of fat? And I was like, that's an option? I didn't
you
know.
ever hear of that prior to that?
Never heard of it before. And they look like, no, it's like this. They're like the nipple goes like this, and there's an overhang. Like, not good. I have not shown my breasts to, like, I'm dating, and because I was so public with cancer, usually the person knows that what I went through. I recently went on a date with someone that's not on social media, and I realized, oh, I can pretend that I didn't have breast cancer. But then when it got to the moment where I need to, I just wanted to keep leaving my bra on, and at a certain point he was just like, and I had to tell, and he asked, I showed him, and that was just the most vulnerable I feel like I've ever, you get clinically looked at so long, poked and looked at, your friends are just like, like at one point, I don't even feel them anymore, and those kind of feelings, you're gonna have feelings forever, and the PTSD that comes up from cancer does not stop, the support does stop.
When you get through treatment, and you start to look a little bit normal, it's over for everybody else, but it's not over for you.
Oh, for sure.
And the shocking part for me has been how hard survivorship has been. Because I'm 6 years out and I'm still feel like it's still such a big part of my life. Yes. And I'm wondering, like, when does that go away? And I think it's always there because you have fear of recurrence and you have physical issues, and you don't always relate to people, especially when you go through it a little bit younger. It's not like your friends know what you're talking about, or what to say, or what to do, or how to react to you, or they think you're back to normal, whatever that means.
Yes.
I've lost some friends where the understanding and the generous grace is gone, and all of a sudden it's like, no, we're back to normal. Why did you cancel plant, or whatever the thing
Why
is?
Are you so tired?
Yeah,
Why are you
or
so tired?
exactly.
I remember everyone telling me, like, aren't you so glad to be done with treatment? And it was like, yeah, I'm glad to be done, but like, I'm trying to rebuild my life from the wreckage here, because everything was shattered, and so yes, I'm excited to be done with the treatment, but I'm not done with cancer, and in some ways I will never be done, because you always have fear of recurrence,
always,
and you always are going to have these scars and these reminders, and there's also a piece that comes with that of knowing, like, basically my worst fear came true, and I'm here to tell the tale, and that's another side of it. You've got those dueling, the devastation, and yet the like, beauty. Hey, I did it. I'm strong. I feel great.
And it's when people say, "Oh, you're a fighter. You're a survivor," and I'm thinking, I did what I was supposed to do. For me, I didn't always want to do it. I made peace with death at the time, because I really thought I wasn't going to wake up the next day.
When I was sitting down with my doctor before chemo, or a nurse at one point, because I had some article come out, and the title of it was like, survivor, breast cancer survivor, and I had not even done chemo yet, and I was like, oh, this article, and I was like, oh, but they called me a survivor, and I'm not a survivor yet. And she reached out, and she was just like, you really already are a survivor. And so that was like, I liked being called a survivor in that moment. But now I don't really like it sometimes because of the reason that it insinuates that I'm finished.
Yeah. And this is still just part of the journey. You know, I'm still in a journey.
Surviving.
I still have to get rid of my ovaries. You know what I mean?
Oh, you do.
And
yeah,
the thought
I did that.
of waiting for that next test result, waiting for the next ultrasound, that sits there. You know what I mean?
Yeah.
I'm thinking, okay, is this the next? Am I going to clear it another 6 months? Am I going to? You know, I'm just constantly. You're going to constantly think about it. And then just because you took it off of here doesn't mean it's not going to come back.
Right.
You're still surviving.
Yeah.
Right.
Surviving.
You know, you're trying to
it's
survive
trying.
day to day to day.
And I'm happy. You know what I mean? And you take those bursts of energy.
That's an interesting thing too, because it's such a weird feeling to feel like, when I was diagnosed, I felt like I will never feel joy again. I'm not going to laugh anymore. Like my life is over in so many sense, so many ways.
Think death.
But it's weird because then I went through treatment and I went through these things, and like there were days where I felt good and I laughed and I made jokes and I felt kind of okay, and it was such a weird dichotomy to feel like, oh, I can laugh, I can feel joy even amidst this absolutely devastating situation.
If you could say to your just diagnosed self, as your present self, just a sentence of advice or a tidbit, what would you say to your
I would
diagnosed
say
self?
You're still in charge. I wish that I had felt more confident in making decisions, knowing that the things that I can control, I can rock that.
I honestly would told myself, looking back, you know, to really love your body. Love what it's going to do for you, what it can do for you. Self-diagnosis, you know what I mean? Like really touching your body, getting familiar with it, feel what's there and what's not there, you know? Some people are scared to touch their breasts or any part of their bodies, or scared to go to the doctor. But to be honestly about getting your checkups, you know, even if it doesn't carry it in the gene, you know what I mean? Like if you don't have a history of it.
What's important, and what I would say to my diagnosed self, is spend a lot of time having conversations with other women that are going through the same thing, because that has been, I've only started connecting with other women in the pandemic that through support groups that I put together.
Groups, survivor groups, whatever, the women that have
Immediate
gone through
sisterhood.
And just total, like they give me the confidence when they say I've done that, and you know, here's what I did and you should try this, and I'm like, okay, I got it.
Thank you guys so much for coming here and sharing and being so open, and we'll see you next time.